They can cause conjunctival damage, goblet cell damage. And this is one study that was done in Japan, and they found out that there is phototoxic effect of an operating microscope on the ocular surface and tear film. So that is also one factor. So all these factors can cause this ocular surface disturbance. Now this is one study which found out that this was a ocular surface disorder after vitreoretinal surgery, and they found out that there was a positive correlation of injection of silicone oil with the causation of ocular surface disorder. Now we use so many drugs after surgery, and that can also have its toxicity. So all these factors, recently there were a couple of studies done, and they came out with a quotient that is called ocular hydration and homeostasis quotient. The basic idea of making this quotient is to have an objective criteria of measuring the severity of disease. So all those factors which support the ocular surface, they are on top, and the factors which they don't support, they are on the bottom. And if the score is more than 1, then this means that the person is having good ocular surface. If the score is less, then it is a disturbed ocular surface. As Dr. Vanathi has very nicely mentioned about all the lubricants, which polymer to use, so I'm not going to do that. So preservative-free lubricants is the key. We don't want preservatives. Carboxymethyl cellulose, sodium hyaluronate, all these factors, compatible solutes which Dr. Rishi was mentioning. So all these factors are very essential to bring comfort to the patient as well as to improve the epithelial surface. The topical steroid and cyclosporin to reduce inflammation. Dr. Rohit Shetty was mentioning about the inflammatory, role of inflammation in causing dry eye. And it's a fact which is a known thing, and there are various factors. So inflammatory mediators are there, and for that cyclosporin and doxycycline and omega-3 fatty acids are very crucial. There is an emerging concept these days. People are more focusing on surface epithelial cells rather than focusing on the breakup time or the Schirmers. They found out that apoptosis is a very important factor that causes symptoms, and the symptoms of dry eye disease is caused by apoptosis. That's a known thing, and UV rays are one which are responsible for causing apoptosis. So a couple of studies have found out that chloroquine phosphate is quite useful in dry eye. How? Because it can reduce apoptosis. Now it's a known antimalarial drug, and it was found to be useful in Sjogren's. They found out that systemic hydroxychloroquine, I'll just take half a minute more. Systemic hydroxychloroquine was associated with improvement in dry eye symptom in Sjogren's syndrome. So that brought the concept of use of chloroquine drops. Now how do they act? There are macrophages, neutrophils, dead dying cells, and they liberate metalloproteases. Now what happens? It results in apoptosis of immature surface epithelial cells. Now chloroquine acts here, so this prevents apoptosis. So that is the key of apoptosis. So that's how it brings about a photoprotection. And it has been found to be effective in experimental animals. It was even safety studies were done, and they were found to be safe in animal studies, and then they started the human studies. And in human studies, they found that it is quite safe to use. Then they did the efficacy study, and they found out that there's better Schirmers, improvement in Schirmer's test. There was a good improvement in breakup time. There was improvement in Schirmers, as I mentioned. The fluorescein staining of cornea reduced with use of chloroquine. The symptoms of dry eye reduced. The microscopic examination showed that the apoptosis was less. And they concluded that chloroquine eye drops have a favorable effect in dry eye syndrome because they reduce apoptosis. So, and the study summarized that chloroquine phosphate eye drops is a therapeutic approach for the restoration of tear formation for dry eye disease. So, I would just like to conclude here and conclude both my talks by saying that ocular surface disorder is something which is a multifactorial. So, we need to have a multifactorial or multiple prong approach, multiple armed approach to handle this ocular surface. Preservative-free lubricants with, of course, those compatible solutes and good hydration polymers are essential. To reduce inflammation, we have the topical cyclosporins, steroids, and omega-3 fatty acids. We need to take care of the lid hygiene by expressing the secretions of Meibomian ducts. And of course, to prevent apoptosis, topical chloroquine phosphate is now coming up with good results. Thank you very much.
Thanks so much, Rajesh. I think you've very nicely highlighted both MGD and